So, good morning and welcome to today's session of the 2022 North Country Leadership Summit, Optimizing Healthcare, Community Collaboration, and Workforce Resiliency. This is the fourth day of the summit. I don't know how it's gone by so quickly. So we just want to give a quick shout out to our sponsors. Without their support, we would not be able to make this event successful each year. And so we thank each and every one of them for all of their support each and every year. And then just a couple housekeeping items for today's session and all of our sessions. Please place all of your questions and comments in the chat. The AHI staff will ensure that your questions are addressed during the Q&A portion of the session. We ask that you remain muted with your video off for the presentation. We will have the ability to allow you to unmute if that's something that we have time to do during Q&A. And then all presentations will be recorded and archived on both the AHI YouTube page as well as the North Country Leadership Summit webpage. And with that, I'm going to turn it over to RuthAnn Craven to share your slides and start your presentation.
Thank you. So good morning, everyone. Thank you for joining me today to learn about age-friendly health systems in New York. My name is RuthAnn Craven. I'm a program manager with the Healthcare Association of New York State, known as HANYS, and I work with healthcare providers to improve the quality of care provided to older adults. I'd like to thank AHI for sponsoring the North Country Health Leadership Summit. I've had the pleasure of attending several years in the past, but this is my first time presenting, so I do appreciate the opportunity to be able to speak with you today. Our topics for today, we're going to start off talking about the age-friendly movement, and it really is a movement. There are age-friendly communities as well as age-friendly health systems and age-friendly public health systems. So we'll talk about how all of them work together. And we will discuss why age-friendly is so important. And then we'll get into a little bit of the details about the Institute for Healthcare Improvements Age-Friendly Health System Recognition Program, as well as the criteria for the American College of Emergency Physicians Geriatric Emergency Department Accreditation. And then I will review with you the free resources that HANYS provides to healthcare organizations to support your work in this area. And we will have time at the end for Q&A at the conclusion of today's presentation. And I do want today's presentation to be interactive. So as I'm speaking, please enter in chat any of your questions or your comments or your thoughts as they come to mind. Okay, I'd like to take a moment to thank HANYS partners and funders for these programs. Age-Friendly Health Systems is an initiative of the John A. Hartford Foundation and the Institute for Healthcare Improvement in partnership with the American Hospital Association and the Catholic Health Association of the United States. Healthcare providers will receive training, project management, and technical support from HANYS at no cost, thanks to the generous support from our funders, the New York State Health Foundation, the Fan Fox and Leslie R. Samuels Foundation, Health Foundation for Western and Central New York, and the New York Community Trust. Emergency Department accreditation is provided by the American College of Emergency Physicians. Hospital emergency departments also receive project management and technical support from HANYS at no cost, and educational resources from the National Geriatric Emergency Department Collaborative. And this work is possible thanks to support from the John A. Hartford Foundation, the Fan Fox and Leslie R. Samuels Foundation, and Health Foundation for Western and Central New York. So even if you've never heard of age-friendly, the phrase probably generates a guess or two about what that might mean to you, to your community, to your patients. In New York State, the age-friendly movement began in 2017 when New York became the first state to be designated by AARP, the American Association of Retired Persons, as an age-friendly state. So this designation is an age-friendly community recognition, so it includes not only healthcare, but it is any aspect of an older adult's life. So it includes transportation, housing, education, recreation, libraries, as well as healthcare. And we know as we age that health becomes more important. So the state has committed to making sure that age-friendly stays in the forefront of our evolving healthcare system. In 2018, then Governor Cuomo's State of the State address included a commitment to have 50% of our health systems become age-friendly in 5 years, which would bring us to 2023. And we aren't quite at that 50% threshold yet, which is why I'm here today speaking with you. We have made significant progress on age-friendly health system recognition. HANYS has helped 84 sites become age-friendly recognized over the past 2 years, primarily hospitals. There were 38 hospitals that we've worked with, as well as 32 physician practices, 10 post-acute care facilities or skilled nursing facilities, and 4 federally qualified health centers. And on the screen, we've listed out our participants that we worked with in 2022, which we refer to as our New York Age-Friendly Action Community. So these are the organizations we helped this year to achieve recognition. So beyond health system recognition, there's also age-friendly public health system recognition. And this is targeted towards public health, so county health departments, the New York State Department of Health, and so on. And they work on 10 action steps of the Trust for America's Health Age-Friendly Public Health System Recognition. And what that program does is really ties together health systems with community-based organizations and population health, and takes more of a broader perspective of age-friendly from a health viewpoint, but incorporating other components as well. But you'll see from all of that New York is really at the lead in implementing age-friendly throughout our communities, our health systems, and our public health systems. So why is age-friendly so important? If you're comfortable, in a few words, how would you describe age-friendly? And you can enter that in chat if you're comfortable doing so. Some thoughts that we've had from other webinars include to respectfully support our aging population, meet their needs and wants, and keep them safely engaged in their care in each setting. You've probably heard supporting providers to age in place. So if they want to stay at home, making sure they have the supports and resources to do so.
RuthAnn,
Yep.
I do see something in the chat that said sensitive. Remember that they weren't always old.
Great.
And so far.
Right. And another is implementing measures to be sure that as many older adults live happy, healthy, energetic, and independent lives. I really like that one as well. So as we know, age is inevitable. By the end of this presentation, we're all going to be 1 hour older. In 1900, only 4.1% of the US population was age 65 and older, whereas the Census Bureau projects by 2050, nearly 20% of the population will be 65 and older. And that really varies by state, by county, by community. So for example, I looked for the 2020 stats for New York. And in 2020, in Hamilton County, 31.3% of persons were age 65 and older. Delaware County, it was 24.5%. Columbia was 23.8%. And Essex County was 23.4%. So we have more than 20% of our population age 65 and older already. And this unprecedented demographic shift is the result of several factors. First is the aging of the baby boom generation. There's just more of us who are getting older. And then on the positive side, there's been a reduction in smoking and other lifestyle changes like improved diet, better exercise. which has us living longer, as well as significant medical advances related to infectious disease or the management of chronic diseases. As we live longer, the cost of healthcare increases. A growing aging population, especially among those older than 85, who are most likely to require expensive long-term care or suffer disability or require assistance with daily activities, comes with serious financial consequences. So now let's talk a little bit about the age-friendly system movement. So it is a growing momentum. More than 2,700 sites of care have been recognized by IHI as an age-friendly health system participant. And it really is a framework that resonates across disciplines and settings. It's not prescriptive. You can apply the age-friendly framework to the care you're already providing at your practice. So for example, if you're a primary care practice, you are likely providing age-friendly care at each annual wellness visit. And the age-friendly movement provides resources and sharing of best practices among peers through an all-teach, all-learn community. And the lessons learned from the movement are informing regulation and policies about the care for older adults. So let's talk about what's involved with achieving age-friendly health system recognition. Age-friendly health system recognition is awarded by IHI, the Institute for Healthcare Improvement, to healthcare providers. So it's for physician practices, hospitals, including emergency departments, skilled nursing facilities, home care agencies, and other healthcare providers that commit to reliably provide evidence-based care to every older adult at every care interaction. Recognition is awarded at 2 levels. Level 1 is participant recognition for teams that have successfully developed plans to implement a framework of evidence-based practice, which is referred to as the 4 M's. And we'll talk about that in a minute, about what exactly the 4 M's are. And the second level of recognition is committed to care excellence, which is for teams that have provided IHI with 3-month counts of patients that have been assessed for the 4 M's. And there's no prescriptive timeline. You can work on implementing or planning your 4 M's care design. And then most teams take about a year before they start counting patients who have received 4 M's care to pursue level 2. But again, you work at your own pace. Okay, age-friendly health systems commit to applying a framework so that the care provided to older adults is age-friendly and addresses what's referred to as the 4 M's. The first of the 4 M's is what matters. So that's knowing and aligning care with each older adult's specific health outcome goals and care preferences, including but not limited to end-of-life care. So the value of asking what matters beyond end-of-life care or beyond advanced care planning, there are several advantages to that. One is not ordering services that the older adult patient doesn't want or won't follow through with receiving. Another is identifying barriers to compliance, such as social needs. For example, if a patient's priority is trying to make ends meet financially, that may impact medication adherence if they're not able to afford their medications. And also finding out what matters will motivate the older adult. So for example, if a patient's goal is to walk their grandchild down the aisle at their wedding, and the patient's working on improving mobility with a physical therapist, and they get frustrated, they don't want to continue with the treatment, reminding them of what motivates them will be inspiring and help them to move forward with their plan of care. The framework encourages sharing what matters across settings of care. While most health systems will pilot age-friendly at 1 or 2 locations, It's really important to take a longer range view to sharing information and spreading 4M's care throughout the health system and even throughout the community. So you can provide age-friendly care that centers around what matters to that patient, and everyone is aware of what the patient's priorities are. The second M is medication. So if medication is necessary, being sure that age-friendly medication that doesn't interfere with what matters to the older adult or their mobility or their mentation is prescribed. A couple of strategies for this. One is reviewing medication lists of older adults against the Beers criteria for potentially inappropriate medication use in older adults, which is commonly called the Beers list. And if these medications are identified, working to deprescribe those. And another strategy is medication reconciliation. We all know how critical medication reconciliation is during transitions of care and may result in less readmissions or unnecessary emergency department visits. The third M is mentation, which is preventing, identifying, treating, and managing dementia, depression, and delirium as applicable. And what I mean by as applicable is in the inpatient setting, delirium screenings are expected, whereas in a physician practice, depression and cognitive screenings are the norm. And the last of the 4 M's is mobility. Ensuring that older adults move safely every day in order to maintain their function and to be able to do what matters to them. So this is about assessing older adults' level of mobility, assessing them for risk of falls, making sure that their home environment is safe from falls. And while they're an inpatient, either in the hospital or a skilled nursing facility, encouraging and assisting the patients to move at least 3 times a day is recommended if they're able. So as mentioned earlier, the 4 M's are a framework to organize consistent, efficient delivery of evidence-based, effective care to older adults. The 4 M's model was designed to lead to the reliable practice of age-friendly across care settings. And the beauty of the 4 M's model is that in some cases, some of the 4 M's might already be in place, at least for some of your older adults. And the providers we worked with this year on age-friendly recognition didn't find implementing 4 M's care to be a burden at all. It aligns well with other programs and initiatives. It really focuses on patient-centered care and whole person care, and the things that you typically do in the care of an older adult. One physician from Maine Care stated in a webinar that asking a patient what matters as soon as they're roomed actually saves time for the primary care team, because patients aren't calling the office after they get home with questions or concerns about what was discussed during the visit and how it impacts their life at home and what they want to do. For age-friendly recognition, the 4 M's are expected to be integrated together into care for patients age 65 and older during every applicable encounter. So for an inpatient, patients would be screened at every visit or upon a significant change in condition, whereas in a physician practice, patients would be screened once a year or at a significant change in condition. And the 4 M's care work together synergistically. So for example, asking what matters demonstrates you value the older person's health beyond their chief complaint. And this conversation may highlight opportunities to adjust the patient's medications or make them more accessible. And prioritizing medications that do not inhibit the patient's mobility or mental acuity will lead to a better quality of life, a more satisfied patient. And we know improved mental health supports improvements in physical health. So how does this 4 M's care look in practice? It's basically your team will assess each older adult patient for each of the 4 M's, what matters, medication, mentation, and mobility. And then if the patient screens positive, adjusting the patient's care plan based on the results of the assessment. So if you identify a need for the patient, how are you going to address that need? Getting into a little bit more detail, so for what matters, someone on your team will ask the patient what matters most to them, and what matters to the patient will be documented, usually in the EHR, and these patient goals are incorporated into the plan of care. For the practices we worked with in 2022, this was the most difficult of the 4 M's for a number of reasons. One, patients may never have been asked what matters before, or they automatically think you're asking about end-of-life care, and that might be something they don't want to discuss. So there was a bit of education on the part of staff and the patient as to what matters means. And the other barrier was EHR systems don't always have structured data fields to document things like what matter to patients. Or staff were documenting it in different sections of the EHR, putting it in a free text field and a progress note. So having a consistent place to document it is really important so you can share what matters with the entire care team, and also documenting it in a structured way so you can share it with the rest of the medical neighborhood. Okay. So for medication, someone on your team will review the patient's medication list at least once per visit for inpatient or once a year for physician practices, and identify any of the high-risk medications, such as those on the Beers list. And if there are high-risk medications, the clinician will work with the patient on deprescribing. For mentation, someone on your team will screen for delirium for inpatients or screen for depression and dementia for physician practices. And then, assess those results. So if a patient screens positive for depression, kind of digging in deeper and looking at social determinants of health that might be causing this or medication side effects. The team can also refer the patient on for further evaluation and treatment, perhaps to neurology or psychiatry. And for mobility, someone on your team will identify the patient's highest level of mobility, for example, using a timed up and go or similar assessment tool. And then the team can work with the patient, or the team can refer the patient to physical therapy or to home care, so that mobility goals can be set with the patient, and staff can work with the patient to address barriers to achieving the goals and track the patient's achievement. So what are the benefits to becoming recognized as an age-friendly health system for your practice? First and foremost, it's improved care for older adults through the delivery of evidence-based care. Second is recognition by the Institute for Healthcare Improvement and the John A. Hartford Foundation as an age-friendly health system participant. And I will tell you, when you achieve recognition, IHI sends you out a press kit of how you can celebrate that accomplishment and make your patients aware, as well as your community aware that you are age-friendly. There is no fee to participate in HANYS New York Age-Friendly Action Community, so the support we provide to you is completely free of charge. And we have available $10,000 stipends for up to 20 teams for 2023 to help support your work with becoming age-friendly. There is no ongoing data reporting required. The only data you need to send is 3-month counts of patients who received 4 M's care when you want to apply for level 2 recognition, to be recognized as committed to care excellence. And you select quality improvement measures that matter to you. You select the assessment tools that are important to your practice or that you might already be using. And it's really a framework that will just be applied to the care that you're already providing to your patients. And this evidence-based care improves the quality of care for older adults, and it has been shown to lower cost, primarily through a reduction in readmissions, as well as a reduction in unnecessary emergency department visits. So now, shifting gears a little bit, let's talk about geriatric emergency department accreditation. So emergency departments can be recognized as age-friendly health systems, but some emergency department physicians pointed out that 4M's care and assessing patients doesn't really fit with the emergency department kind of way that they operate. Geriatric Emergency Department Accreditation was developed by the American College of Emergency Physicians and leaders in emergency medicine to be sure that older adult patients receive well-coordinated quality care at the appropriate level at every emergency department encounter. So what does a geriatric emergency department do? So they have a number of best practices. The first is making sure that the staff in the emergency department has had some training on the care of geriatric patients. And also having the availability of interdisciplinary staff if a patient in the ED needs that assistance. So, for example, if a patient is in the emergency department and they need a psych consult or a neurology consult, or they need to work with a physical therapist, or they need a pharmacist, having that staffing available if patients need it when they're in the emergency department. The second is standardizing the approach to care that address common geriatric issues, for example, catheter use or restraint use. How do you care for geriatric patients under those policies? Third is ensuring optimal transitions of care from the emergency department to other settings, including inpatient, home, community-based care, rehabilitation, or long-term care. We're working with 15 emergency departments this year on accreditation, and 3 of those have selected as their quality project to improve transitions of care from the emergency room to their local skilled nursing facilities to kind of prevent the repeat visits to the emergency department if possible. And lastly, it's promoting a geriatric focused quality improvement project. And then making sure that the physical environment and supplies in the emergency room are available to meet the needs of older adults. Accreditation is at 3 levels. You start at level 3, which is bronze, and the accreditation is valid for 3 years. Hospitals do have the opportunity to level up to level 2 silver or level 1 gold during their 3-year accreditation period if they choose to pursue a higher level of accreditation. So level 3 bronze accreditation is a basic standard of care that every emergency department can and should provide. They're not looking for you to have a separate emergency room for older patients. They're not even looking for you to have separate, exam rooms within your emergency department for older patients. It's just making sure that you're providing appropriate care for the older patients that present at your ED. So the criteria for level 3 accreditation, for staffing, they ask you to select a physician champion, which is an MD or a DO, who has had at least 4 hours of focused education on geriatric emergency medicine, and select a nurse champion who has had some training on geriatric emergency medicine. There's not a required number of credit hours for the nurse. And these two, the physician champion and the nurse champion, are what I like to think of as your subject matter experts in the ED on the care for older adults. And they kind of spread the message to the rest of the team. They're there to bounce ideas off of, and they're really leading the geriatric ED accreditation project. For equipment and supplies, you just need to have access to mobility aids, such as canes and 4-point walkers in the emergency room. The reason for that is we want to encourage older adults to keep moving if possible. And if the patient needs assistance and a mobility aid, they need to have that equipment available right there for them to use. For physical environment, you need to have easy access to food and drink 24/7. They're not asking for you to build comfort stations in your ED. This can be provided through your dietary department. But it's just really important to have a process so patients can get access to food or drink if they need it. In particular, for older adults during the hot summer months, dehydration could cause dizziness, which would limit mobility. or it could impact your mentation screenings. So it's really important to have access to food and drink. The last area is policies, guidelines, and procedures. This is asking the ED to develop a quality improvement project around a geriatric topic. You don't need to submit data. You don't need to provide results. They just want you to have a policy and procedure in place. Explain how you train your staff on that process and how you monitor that process to see if it needs to be improved over time. To give you an idea of the types of quality projects, this year we had 9 emergency rooms working on reducing geriatric falls. We had 3 emergency rooms working on improving transitions of care from the emergency room to skilled nursing facilities. We have 1 working on addressing elder abuse, and we have 1 working on addressing agitation in patients without the use of sedations. So that gives you an idea of the types of quality projects, and you pick whatever is most important to your hospital or your emergency room, and it can align with your other projects and initiatives that you're working on. For 2023, the American College of Emergency Physicians will also be asking for 3 policies to be provided by the geriatric ED. 1 on urinary catheter minimization, 1 on NPO status minimization, and 1 on physical restraint use. These are areas that the college has found to be particularly important for the care of geriatric patients, and they know emergency departments have policies around these topics. They just want to know how exactly you care for geriatric patients within those criteria. Okay, so the benefits for a geriatric emergency department, 1, just like age-friendly health system recognition, it's improved care for older adults in your emergency room. It's also becoming accredited by the American College of Emergency Physicians. HANYS offers no-cost support to you to help you get through the accreditation process. And we have scholarships available to cover the application fees for level 3 bronze accreditation for up to 18 hospitals in 2023. You select a geriatric focused initiative that matters most to you. And like we said, providing evidence-based care to older adults leads to improved quality and lower cost of care, particularly a decrease in unnecessary emergency department visits. And if you're also interested in age-friendly health system recognition, this year IHI has put together a streamlined process to recognize geriatric emergency department accredited sites. So the 2 programs work hand in hand. Okay. So HANYS is available to support the work you do, whether you choose to pursue age-friendly health system recognition or geriatric emergency department accreditation at absolutely no cost to you. We host a New York age-friendly action community for age-friendly health system recognition. And we host a New York geriatric emergency department accreditation collaborative for geriatric emergency department accreditation. So for our age-friendly action community, we provide education about age-friendly care at no cost, and the programs include continuing education credits for your CPHQs, so your continued certified professional health quality staff. We provide project management and technical assistance with achieving recognition from IHI, as well as I'm available for one-to-one coaching for any topic related. So the types of things I've done is work on revigorating patient and family advisory councils, or help your team learn how to do process mapping and workflow redesign. Or very popular is if you need a staff member or you need something to implement age-friendly care, how to write a business plan that demonstrates the value of age-friendly care, so you can get the additional staffing or resources that you need. We also have collaboration with an all teach, all learn model. This month, we've had all of our teams that participated in 2022 do a rapid fire 5-minute presentation to all the teams about their success story. which was really great to hear what everyone has done and everybody can learn from each other. I also provide a weekly email update with information, deadlines, as well as resources to help you achieve recognition. And like I said, we'll have stipends worth $10,000 each to be awarded to up to 20 participant organizations for next year. The benefits for the New York Geriatric Emergency Department Accreditation Collaborative are pretty much the same. The only exception is the financial assistance is paying the fees to apply for the initial level 3 bronze accreditation for up to 18 hospitals. Hi. These are just some links to additional information about age-friendly health system recognition, as well as you can review our participant materials from 2022, as well as some links to information about Geriatric Emergency Department accreditation. HANYS is currently accepting applicants for both our 2023 New York Age-Friendly Action Community and our New York Geriatric Emergency Department Accreditation Collaborative. Providers can apply to either one or both of the programs. And if you are interested, my email address is here. You can certainly reach out to me if you have any interest in that. All right, so now I'd like to open it up for questions. What questions do you guys have for me? If you have any questions, feel free to enter them in chat or comments as well. So AHI team, if you want to read off the comments, that would be good too. There.
Perfect. I do see a couple questions and comments in the chat. So pertaining to the how would you describe age-friendly care in the beginning, we did have another comment. I didn't want to interrupt you at the time. It said, even though it isn't always possible to have what they want and need, ask them and listen. When something isn't possible, try to adjust it to a level that is possible and praise them with the wants. We had some comments. Thanks, RuthAnn. I am so happy New York is focused on improving age-friendly care. The program seems well organized. And then we do have a question. You talked a lot about ED accreditation, but is this relevant for community health centers or ambulatory care centers?
So for community health centers and ambulatory care centers, you would want to be pursuing age-friendly health system recognition. And we have a number of federally qualified health centers and outpatient clinics at hospitals that have been recognized through that program.
Perfect, thank you. Does anyone else have any questions that they'd like to put in the chat or comments?
And to Mary's comment, the governor is also working on a master plan for aging. So over the coming months, you're going to see a lot more information about how age-friendly communities interact with age-friendly health systems and age-friendly public health systems. Okay, let's see. Is there stipends, technical assistance available for federally qualified health centers as well? Yes, as a federally qualified health center, you would be eligible to apply for one of our $10,000 stipends. And we are awarding those to up to 20 participants for age-friendly health system recognition for next year. We typically have about 40 participating teams, so about half of the teams are awarded the stipends. And the criteria will be based on your application. We'll review it based on if you're new to age-friendly health system recognition is important, a financial need, as well as the ability to meet IHI's requirements to be recognized, and then the impact of the program. So we'll want to know how many older adults you expect to reach, as well as sustainability. So they're kind of the criteria we look at for the applications. Our stipend applications will be due on November 30th of this year, and we'll announce who has been awarded stipends right before the holidays on December 21st. And then you can really hit the ground running in January with your recognition process.
Perfect. Very thorough. I appreciate that. I don't see any other questions coming through yet. I will say that the Adirondack Rural Health Network, we put out an executive summary every 3 years to coincide with our local health departments and hospitals having to complete their community health assessments. And it was funny because I was looking at the prevention agenda prior to joining our call today. And our executive summary always does state that New York wants to be that age-friendly state, and we're going to do it. And so it was perfect timing. Does anybody have any other questions or comments? And if not, then I will close up today's session.
All right. Well, thank you all so much for your time this morning. And if any questions come to mind, or if your organization is interested in working on age-friendly recognition or geriatric emergency department accreditation next year, please feel free to reach out to me, email me at any time. I'm happy to answer your questions or help. Thanks so much, everybody. Have a great day.
Thank you.
Thank you.